Welcome to the Homerton University Hospital's physiotherapy departments, groups and classes. Our educational videos hope to guide you through the do's and don'ts of exercise to ensure you get the best results and complete our classes safely. For other educational videos and advice, take a look at our YouTube page or visit the Homerton Hospital website www.homerton.nhs.uk. This video is useful to guide you through your exercise and rehabilitation plan. Hopefully you'll be more aware of the appropriate pain levels we experience when exercising. You'll be independent in monitoring and progressing how much effort you should be putting in, and also we'll cover other top tips that will help you succeed in managing your pain problem. There are different types of exercise, some of which you may be more familiar with, but none of which are harmful for the body if done in the right way at the right time. Your physiotherapist will have introduced you to some of these already. Strength or resistance training. This is using a weight or perhaps a resistance band or a machine in a gym to work your muscles hard in order to increase your overall muscular strength. Stretching and flexibility is an important part of managing pain conditions and can help to reduce future injuries. Cardio or cardiovascular fitness is generally thought of as a repetitive or endurance exercise, such as running, cycling or swimming. However, you can improve your cardio, also known as aerobic exercise, with any type of exercise as long as you're working hard enough to increase your heart rate, your breathing rate, and you may be getting hot and sweaty. But not so hard where you need to stop very soon after starting. Advanced muscle training is a broad term that will be discussed more in our Return to Sports educational videos and classes. This is important for enhancing performance, skill, speed, and helping to return to competitive sports with reduced risk of re-injury. Of course, exercise can be anything you want it to be. If exercise is goal-orientated, meaning that it is personal to you, based on your pain condition, then it is more achievable and easier to see if we've improved or not. Strength training. Are you doing the right amount or the correct intensity of exercise? With strength training, it is important to achieve the correct intensity of exercise to achieve the best results. This means changing how much weight or resistance you need to hold in order to get stronger effectively. Firstly, let's cover the basics. Repetitions are how many you do at one time without taking a break. Sets are how many cycles of those repetitions you do. For strength and resistance training, we would like you to do around 8 to 12 repetitions of an exercise, take a short 30 to 60 second rest, then repeat it 3 to 4 times in total. This could be squats, overhead press, step-ups or lunges, and so on. However, sometimes different exercises have different difficulties. For example, I could probably do more than 20 squats, but I don't think I could do 20 lunges properly. The trick is to add or take away weight or resistance in order to become tired in between 8 and 12 repetitions. Therefore, if I held a 20 kilogram weight and started squatting, but could only do 5 before I started losing correct technique or I had to stop, then the weight would be too high. I know that I can do over 20, so I need to add some weight. So after a short rest, I may try around 10 kilograms and find I start to get tired around the 8 to 12 mark. 10 kilograms is the right weight for me for this exercise. However, because you're returning from an injury, we don't want you to go until complete failure. Aim to have a couple of repetitions left in the tank. Using this information, we hope that you're able to adjust the difficulty yourself and always get the most of each exercise. Remember, we have different difficulties in different exercises and we are all individuals. 10 kilograms for a squat would be probably too much for the same person doing a lunge as well. The good thing about learning this is it can be adapted to any strength or resistance training. As you get stronger, you'll be able to do more repetitions and therefore you will need to add more weight to get the best out of your program and to get stronger. How many times a week should you perform strength training? Scientific research shows us that for most people, 3 times a week is the magic number for strength training. A day off in between sessions for recovery is important. This doesn't mean you can't do some flexibility work, cardio or other light exercise in between days. However, full rest days are important at some point in your week. Guidelines for cardiovascular exercise is that we should all be performing at least 150 minutes of moderate exercise a week. This is a minimum. Also, it is always helpful to have a goal to work towards. So, how hard should you work? Good question, and an answer that may be different for everybody. We're going to use breathlessness as your indicator to how hard you will be working. This is a good measure of cardiovascular effort. Using this scale, we are able to set a level of exercise that is appropriate for you. The scale is adaptable to different exercises, and you'll be the best judge of how you feel. An effort of 0 to 1 is too easy. A score of 2 to 3 shows some increase in your breathing, but you could comfortably continue at this rate. 4 to 6 is getting hard. You may be breathing quite heavily, but still able to hold a short conversation. Certainly, this is becoming challenging. 7 to 8 is really hard. You'll be short of breath and can only speak short sentences. You cannot continue for more than a minute. Not being able to string a few words together due to breathlessness would indicate a score of around a 9. If you're completely out of breath, can't talk, you're completely unable to continue, you're working too hard. That would be around a level 10 maximal effort. If you are a beginner or you're restarting exercise after a while out, or if this is new exercise to you, then we recommend trying to set your level of exercise at 2 to 3. This is easy to moderate and you will feel some increased breathing. However, if you are familiar with regular exercise, we believe you would be best suited to start working at around 4 to 6. This shows that you are working at a hard level, your breathing is laboured, but you could keep going and hold a short conversation. For those of you that count themselves as advanced with exercise, then you can start to challenge yourself more. You may find that as you continue over the course of the exercise program, you feel more confident to push yourself from the previous levels towards this one. Level 7 to 8 is really hard. You'll be short of breath and can only speak a sentence. You couldn't continue for more than a minute. Pain following exercise is common, but how much is too much and what can you expect? Experiencing muscle pain after a workout, sometimes called DOMS, is a normal response to exercise. You may be sore the next day and may be worse the 2 to 3 days after. This is very common when starting a new or challenging exercise. It is a good sign that you've worked your muscles, and with continued sessions, they are likely to get stronger and you'll start to feel better. When you have DOMS, it may be uncomfortable to do normal daily activities. Things like going up or down stairs or standing up can be really uncomfortable, but that pain doesn't mean you've done any damage to yourself. It is, however, safe to exercise with DOMS. Now, we do recommend starting light, become confident with your program, and then gradually increasing your exercise to push yourself. Perhaps spend a little longer warming your muscles up and stretching prior to starting, and remember, rest days are important. You have been referred to physiotherapy because you are in pain. You will have been assessed that exercise is safe for you and part of a treatment program to help you get better. Pain during exercise is safe, but we want to try to guide you towards the right level of pain. Using the 0 to 10 scale can be really useful and ones that doctors and physiotherapists use. 0 is no pain, 5 is moderate pain, and 10 is the worst pain imaginable. Have a look at the green zone, 0 to 2. If you feel low amounts of pain, that's safe. You can probably start to push yourself once you feel confident to do so. The yellow zone, also safe. In the yellow area of pain, this is probably the more preferred amount of pain you should be experiencing. Once you get towards the amber and orange levels of pain, around 5 to 6 out of 10, then caution is advised. You are unlikely to damage yourself, but you may be at risk of flaring up your condition. Red zone. So high levels of pain in exercise are less desirable. So anything from 7, 8, or just behind me, 9 and 10, is too much pain. To reduce how much pain, then you may need to adjust the intensity or type of exercise. Have a look at the previous slides on how to do this. Unfortunately, we can't wait for your pain to go before we start a treatment program. We know that resting and avoiding pain will only make you worse, and the struggle back to normality will be harder. Persist with the program and you'll see results over the course of weeks to months. Not convinced on pain being okay? We discussed pain education in some of our other talks, but this useful exercise can help people understand that pain is not always as bad as the body and brain make out. Take something that is painful, something that we have all likely experienced over our lifetime. I will give you an example first of all, and then what we'll do is we'll pause, have a think of some of your own, and then we'll come back and I'll go through another few examples. First of all, banging your shin. Pretty painful, so much so sometimes you can't put any weight on your leg and you need to sit down and rub it. I would say it is somewhere between moderate and high pain. And how much damage do we think? Probably not too much, probably less than low or potentially no damage at all. Think of a couple yourself and we'll come back in a moment. Another few examples are a paper cut. Quite sore and painful, maybe just below moderate level of pain, maybe higher for some people. The damage that occurs is really low and only a single layer of skin is damaged normally. Have you ever broken a bone or sprained something badly maybe? It hurts a lot and the damage can be quite high too. So high levels of pain can be high levels of damage, but also high levels of pain can be moderate, low, or no damage at all. Finally, an interesting one, a hot surface. Normally the body and nervous system will produce a painful response, ouch, and you'll quickly move your hand away. So it can be very painful and actually, if you've moved your hand quick enough, no damage whatsoever. This is actually your nervous system doing its job very well. Of course, there are instances where you can burn yourself through liquids and other things, and you can't move your hand immediately, and therefore you may damage yourself. So, pain is a protective mechanism. Often you will experience pain before damage even occurs. Exercising in pain is safe if performed gradually and within your own limitations. The trick is then to push yourself harder. Acute or new injuries, they are instances to be more protective over. If you've suddenly hurt yourself, like a sprained ankle or severely bruised arm, then following acute injury price management can be helpful, easily found on Google. Setting the right expectations is really important. With the wrong expectations, you can get disheartened or frustrated that you're not finding improvements that you expected. It takes approximately 6 to 8 weeks minimum to see muscle changes. That might seem like a long time, but these changes can be long term. Persistence and motivation to continue are really important for all of us. You may experience mild increased pain and then gradual reduction. This is normal and probably expected with a lot of conditions. Revisit slide 11, how much is too much pain, to remind yourself what levels are fine. We expect a joint commitment to you getting better. We will do our best and we expect the same from you. It is hard work, but we will help you through it. Things don't change overnight, and also there is no quick fix. We wish there was a way we could offer you a quick fix, but they just don't exist for pain conditions. When to discuss with your physiotherapist. Now this could be with your individual physiotherapist that referred you to the class, or it may be one of the physiotherapists within the group itself. So if you're experiencing increased pain, abnormal swelling, or a significant change in temperature around your injury, 2 to 3 days or 48 to 72 hours after exercise, consult with one of the physios. If you experience any new injuries or recurrence of your injury, or if you're considering taking up a new sport or activity, as you may need your program changed. Remember, work within your own limits, but then it's time to push yourself gradually. Take any medications as usual, including having your inhaler or a GTN spray close by. If you don't know what a GTN spray is, not to worry. Be prepared with your laptop or phone. Have a towel and a bottle of water close by. Most of all, we hope you enjoy your sessions with us and you are ready to join our exercise class.